helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. Happy Friday. Today we are talking about something that everyone has to deal with from time to time. It's back pain. So we have Joe DeLapa from Cabell Huntington Hospital Pain Management Center here. So what is the deal with all this back pain? What are the common causes of the low back pain? That's something that I know a lot of people have.
Yes, thanks for having me on, Hattie. So low back pain is a very common condition. It's expected to occur in approximately 80% of individuals sometime during their lifetime. And that's a part of just the trials and tribulations of being an upright human being, where the force of the body puts downward pressure on the low back and joints. And there are many individual components of the low back that are susceptible to injury over time, from things such as lifting or injury, and these include the bones or the vertebra of the lumbar spine, as well as the individual discs, which could be thought of as the shock absorber or the support of the lumbar spine. And there's also many small joints throughout the low back that allow for movement that can be injured or have chronic degeneration that can lead to low back pain.
So a lot of room for pain. And
exactly.
You said lifting, so
Yeah.
my thought went straight to moms picking up the babies. Do women experience lower back pain differently than others?
Yes, that's a very good point. Absolutely. I mean, you think of mothers lifting children that weigh 20, 30, 40 pounds regularly. That puts a lot of strain on the lumbar spine. So I always recommend, proper lifting techniques, and these are things that we definitely discuss and try to educate patients about.
And now we talked about mom, but how about the kids? Do they expect back pain? We have adults complaining all the time, but how about them?
Well, in times past, children with back pain was somewhat uncommon, but over recent years it has become more common due to things like more competitive sports that can put a lot more stress, especially with hyperextension of the spine, where children can develop stress fractures that can progress further in life. And also, even at school, I mean, you think about children wearing backpacks. The American Academy of Pediatrics typically recommends no more than 10 to 20% of the weight of the backpack being 10 to 20% of a child's overall body weight. So take that into consideration.
And it seems like that debate continues on whether kids should really be how they should be carrying their books. They're carrying them through school, carrying them on their back. It's just every day they really do have a lot of weight. Now, are there any ways that you can prevent this?
Back pain in general can be prevented by a lot of lifestyle modification changes, is what I like to say. For adults, I mean, I typically recommend weight loss. That's definitely a big factor because it's just extra stress on the lumbar spine. But also things like regular exercise, which will help strengthen the core muscles, which help stabilize the spine, and also increase the range of motion. And one big thing I always see is smoking. I always tell individuals to stop smoking because there's evidence that shows that smoking contributes to degeneration of the joints. And that also can cause a lot of potential back pain issues. And we do have a pretty large smoking population here in West Virginia. Absolutely. So it's something that you see a lot. So that's a helpful tip. That's something definitely to take into consideration. Now, treatment options, because if you've already got it, you want to get rid of it. How do you do it? Well, at Cabell Huntington Pain Management Center, we really focus on a multidisciplinary approach to treatment of back pain. And what that means is we don't focus on one specific aspect, such as just a medication. We actually like to incorporate things such as physical therapy, different types of medicines that approach pain from the low back from different perspectives in terms of trying to alleviate the symptoms, but also we focus a lot on interventional treatment options and potentially surgery. These include things like injections that we do under fluoroscopic guidance to help alleviate symptoms, and if necessary, referral to our neurosurgery department, which may be necessary, but usually last resort. Well, is that kind of how everything's developing? You're not just using medicines anymore, you're doing a lot of more physical therapy and treatment and such like that? Yeah, absolutely. Like I said, this is more of what's called a multidisciplinary approach, meaning that we try to attack it from different aspects to try to treat the symptoms, and overall it seems to offer more benefit. Well, some people benefit from other treatments versus others. Some people need different things done. Yeah, absolutely. I mean, some individuals aren't candidates for certain types of medicines, so certain interventions may be more appropriate, or vice versa. In addition, I always recommend to patients that there's some alternative treatment options they can consider, and these include things like yoga for if it was more like strain, or acupuncture even, or massage therapy. So there's a lot of other different types of treatment options to consider out there too. Didn't realize yoga could be one. That's interesting. Okay, and then just I want your quick response on this one. Going to the chiropractor. I think chiropractor is appropriate. I do think that absolutely there's definitely a role for chiropractic care. I think that if you experience some difficulty or pain, then that's the time for you to stop this, because I think that it's something that if your body's telling you it's not right, then it probably isn't.
Good advice. Thank you so much for staying with us today. And if you want any more information, you can just go to our website, WSAZ.com, click on the Moms Everyday link. You'll find this interview and other details, and also make sure you download our app, Moms Everyday. Thanks for joining us. We'll see you again on Monday. Have a good one.